Meet Jacob. At age 10, Jacob was playing near the open cooking fire in his home when his clothing accidentally brushed the flame. His body caught fire, and 60% of his skin was burned. Jacob and his mother then made the long journey to the burn center in central Tanzania, where the doctors attempted to perform the gold standard treatment of autologous skin grafting. This method involves transferring a healthy piece of skin from the patient onto the wound bed. Yet, with so much of his skin burned, his doctor couldn't find a large enough patch for grafting and regrowth. In a high-income setting, surgeons would have access to graft expansion devices, but Jacob's doctor did not have this option.
Of the 180,000 annual burn mortalities, 95% occur in resource-limited settings due to the lack of access to skin graft expanders and other burn surgery tools. Let's look at some quick figures. There are 4.97 million burns that occur each year in resource-limited settings. Of these burns, 2.26 million are severe enough to require skin grafting. Because skin grafting is associated with a 25% reduction in mortality, there are approximately 43,000 preventable burn-related deaths that occur each year. So what's missing in these settings?
High-resource environments have the machine mesher, a device that makes a series of parallel incisions in the graft that allow it to expand into a net-like pattern. Skin then heals through the interstices. However, due to the bulky size, high level of maintenance required, and most importantly, initial price point of around $10,000, these devices are inaccessible in resource-limited settings. As a result, surgeons may mesh by hand with a simple scalpel, which can be highly inaccurate and requires a high level of skill to perform uniformly. That's where Velocigraft comes in. Our solution is a two-plate meshing template between which graft is compressed. Unique interlocking ridge geometries on the template interior serve to create the incision pattern, maintain tautness in the graft, limit wear and tear to the device, and facilitate a smooth scalpel motion without the need for up and down hand movements, making the device intuitive for use by physicians across training levels. The device seeks to achieve an area expansion of 2:1. To test the device, we use chicken skin as a model for human skin grafts due to its similar material properties and expansion capacity. With an average expansion ratio of 1.8:1, our device represents a significant improvement upon the 1.1:1 expansion achievable by manual meshing as performed by an experienced surgeon in Mozambique. This makes the template comparable to machine mesher expansions reported in the literature. Additionally, the average area of each hole in the template meshed grafts successfully falls below the 0.75 cm squared benchmark needed for quick wound closure. When it comes to cost, combining sale price with single-use consumable and maintenance fees, one machine meshed graft sits at $40. By contrast, our template 3D printed with stereolithography and autoclavable medical-grade resin represents a cost reduction of almost 99% per procedure, making it financially viable for resource-limited settings.
The Velocigraft solution is simple yet refined, giving it the potential to save thousands of lives each year, and we're truly excited to bring it into the hands of those who need it the most. Thank you for watching.